You've been lied to your whole life. They told you masturbation was dirty, that by the time you turned 50, you should have outgrown it. But here's what no one ever said. After 60, masturbation isn't just normal, it could be the key to staying healthy and vibrant. I'm Dr. Mohit Kara, a urologist and professor of men's health at Baylor College of Medicine. For over 30 years, I've treated men just like you, men suffering not from disease, but from shame, misinformation, and what they were never taught. Here's the truth. Most older men either masturbate the wrong way or stop altogether. They don't realize that how you touch yourself, how often, and with what intention affects your hormones, your heart, even your brain. Done wrong, it can lead to erectile dysfunction, depression, and prostate issues. Done right, it can boost testosterone, improve sleep, and keep your vascular system strong. This isn't just about pleasure, it's about preserving function, reconnecting with yourself, and fighting aging where it starts, in the nervous system. And now, I'm going to share with you 7 masturbation truths every man over 60 should have learned decades ago. But first, ask yourself this. If one small daily habit could improve your health, your energy, and your mood, wouldn't you want to know what it is? Stay with me. What you're about to hear could change the next 10 years of your life. Before we dive in, if you haven't already, take a moment to subscribe and hit the notification bell so you never miss another honest, science-backed health insight made for men like you. If this message speaks to you, type 1 in the comments. If it doesn't, type 0. Your feedback helps me make better content for you. Secret number 1. Mindless masturbation causes numbness and ED. I wish more men had the courage to talk about this. Over the years, hundreds of older patients have come into my office looking ashamed, voices low. When they finally open up, I ask, "Do you still masturbate?" Almost always, they say, "Yeah, but I barely feel anything anymore. I can't finish unless I do it a certain way." Or the one that stuck with me, "It's like my body forgot how to feel." The truth is, they had trained their bodies into dysfunction. Quick, mechanical, disconnected masturbation rewires your brain. Tense shoulders, scrolling through intense porn, using the same hand, same motion, same outcome. Your brain learns to associate arousal with that exact pattern. And the brain learns fast. Over time, your sensitivity drops. Erections get weaker. You need more pressure, more stimulation, more tricks just to feel something. You struggle with real intimacy because it's slower, more emotional, more human. Eventually, you avoid it. And that's where the real damage begins, not just physical, but emotional. I've seen men spiral into frustration, shame, even depression, believing their bodies are broken. But in many cases, they're not broken, they're just miswired. This pattern can lead to porn-induced erectile dysfunction, delayed ejaculation, or even anorgasmia, the inability to climax at all. These aren't rare. They're quietly affecting millions of men, and most have no idea why. It's something many men have unknowingly done to themselves. But here's the worst part, and I need you to really hear this. When you condition your body this way and never change course, it's not just sex you lose, it's confidence, connection, and yourself. You start pulling away. Your relationship with your own body grows distant. You avoid touch, you avoid closeness. And for many men, that isolation becomes the gateway to darker places, emotional distance, depression, even early cognitive decline. I've seen it again and again. The cost isn't just in the bedroom, it's in your spirit. It's in the way you enter a room and how you stop looking at yourself in the mirror. You begin to disappear. But I'm not here to shame you. I'm here to wake you up. Because here's the good news. Your body can relearn. Your nervous system can heal. But it takes awareness, patience, and a completely new approach to self-pleasure. One that's slower, more mindful, more connected. Not just to sensation, but to emotion. Masturbation isn't the enemy, but doing it without awareness is like putting your car in gear and flooring the gas without touching the steering wheel. You'll crash, and by the time you realize it, the repair may take far longer than you think. But here's something even most doctors don't talk about. While mindless masturbation can harm you, total abstinence can be just as dangerous. And the worst part, it's quiet, it's common, and society often praises it. In the next secret, I'll explain why not masturbating at all after 60 could be silently sabotaging your secret hashtag 2. Masturbation reduces prostate congestion and inflammation. Let me tell you about a man I once treated. Let's call him David. He was 68, proud, private, the kind of man who didn't like to talk about personal stuff. But he came to me because he was waking up 5, sometimes 6 times a night to pee. He felt pressure, fullness, even a dull ache deep in his pelvis. He thought it was just old age. What he didn't expect me to ask was, "When was the last time you ejaculated?" He looked at me like I was crazy. "Years," he said. "My wife passed away, and I figured men my age were supposed to stop doing that." That right there is the myth. That after 60, 70, you're just supposed to shut the system down. But here's what I told David, and what I'm telling you now. Your prostate doesn't stop working just because you stop ejaculating. It keeps producing fluid. And if that fluid isn't released, it builds up, creating a stagnant reservoir inside your body. That buildup leads to prostate congestion, inflammation, and discomfort. And over time, real health risks. Your prostate is not designed to store fluid indefinitely. When it does, it swells, it gets irritated. That's when you start feeling urinary urgency, weak stream, dribbling, even pain during urination or ejaculation. Most men chalk it up to just aging. But in many cases, it's simply a system backed up and under pressure. And here's where it gets serious. Chronic inflammation in the prostate is linked to a higher risk of prostate cancer. I'm not saying abstinence causes cancer, but frequent ejaculation reduces the inflammation that makes your prostate vulnerable. In fact, a large Harvard study followed nearly 30,000 men and found this. Men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer. That's not a myth. That's data. And as for David, once he understood what was really happening inside his body, he made a change. He started touching himself again, not out of lust or loneliness, but out of care. Slowly, his symptoms improved. The pressure eased. His sleep got better. But more than that, something in his eyes lit up again. He reconnected with a part of himself he thought was long gone. Because the cost of ignoring this part of your health isn't just a few bad nights of sleep. It's chronic discomfort. It's medications you might not need. It's surgeries you could have avoided. And yes, even a higher risk of cancer. All because of one quiet belief, that a man your age should no longer claim this part. But think about it. You wouldn't ignore your heart. You wouldn't ignore your blood pressure. Don't ignore your prostate. Now, what if I told you that the shame men feel, years of guilt, silence, and discomfort around touching themselves, doesn't just hurt emotionally. It makes the physical symptoms worse. That's what the next secret reveals. Because once you understand how emotional repression drives physical decline, you may never look at your body the same way again. Secret 3. Shame around self-touch damages your mental health. There's a certain kind of silence I see in a lot of older men. It doesn't show up in what they say. It shows up in what they don't. It's in the way their eyes shift when I ask about their sexual habits. The way their shoulders slump when I say the word masturbation. The way they laugh it off, change the subject, or quietly say, "Doc, that's not something I do anymore. That was for when I was younger." But I can hear the subtext. It's not that they stopped because they wanted to. It's that somewhere along the way, they were taught it was wrong to keep going. Let me be clear. This kind of shame, quiet, unspoken, is one of the most dangerous forces working against your health today. For decades, you were told that touching yourself was dirty, sinful, weak. You were punished, ridiculed, shamed. And those early messages didn't disappear. They just went underground. They settled into your nervous system, deep in your bones, quietly shaping your relationship with your body, even now. The result? You begin to withdraw, to disconnect from physical touch, even when you crave it. You start seeing desire as something inappropriate. You stop reaching for yourself, not because you don't want to, but because you've been conditioned to feel you shouldn't. And over time, that disconnection becomes more than emotional. It becomes biological. Because here's what most men don't know. Regular, healthy sexual touch, including masturbation, supports mental well-being in real, measurable ways. It lowers cortisol, your stress hormone, boosts dopamine, your pleasure and motivation chemical, releases oxytocin, your trust and connection hormone, improves sleep, mood, and even brain function. But shame shuts all of that down. Shame tenses your muscles, raises your stress hormones, creates endless guilt loops in your mind that you no longer even notice. And chronic shame is more than just emotional pain. It's a stressor. And chronic stress has been linked to anxiety, depression, heart disease, immune dysfunction, even dementia. I had a patient once, 72, recently divorced, deeply depressed. No meds, no major health issues, but exhausted, numb, isolated. He told me he hadn't had any sexual activity with someone else or alone in over a decade. I just thought that chapter was closed, he said. But beneath those words was grief, not just for the loss of sex, but for the loss of self. We worked together, slowly. No pills, no drastic changes, just simple, conscious exercises to reconnect him to his body, without guilt, without expectation. And after a few weeks, something shifted. He started walking taller, sleeping better, and laughing again. His blood pressure came down, not because he was fixed, but because he had reconnected with himself. That's the true cost of quiet shame. It slowly drains your vitality, inch by inch, convincing you you're too old to feel alive. But the truth is, you're never too old. You're never too old to touch yourself with kindness, with dignity, with intention. And if shame alone can cause this much damage, imagine what happens when horror. Here's the truth no one tells you. Testosterone, the hormone that powers your strength, energy, confidence, and desire, doesn't just fade with age. It fades faster when you stop engaging with your sexual self. When desire is ignored, buried under years of shame or silence, the body gets the message. He doesn't need this anymore. And it starts to shut things down. Blood flow slows, hormones drop, energy fades, muscles weaken, sleep worsens, and the spark in your eyes begin to dim. Not because you're old, but because your body isn't being reminded that you're still alive. I remember Frank, 73, a retired firefighter. Once full of strength, he came to me slouched, tired, saying he just felt like he was slowing down. His testosterone was barely above clinical deficiency. When I asked about sexual activity, he just shook his head. I don't see the point anymore. That belief, not age, was the real threat. The moment a man stops seeing his sexuality as a living, vital part of who he is. I helped Frank re-engage, not with anyone else, but with himself. Simple, shame-free practices, no pressure, just presence. And within a few months, things shifted. His hormone levels rose, his posture changed, his voice carried more weight. He started lifting weights again. His eyes lit up. Your body responds to what you give attention to. Ignore your sexual self, and testosterone retreats. But even solo, intentional touch sends a powerful signal to the brain. I still need this. I still want to feel. And the brain responds by turning back on systems that had gone dim for years. This isn't just theory. Studies show testosterone can get a short-term boost from sexual stimulation, even alone. Erotic imagination, physical touch, and anticipation all help regulate hormones, mood, and motivation. Your body is built to respond to pleasure, connection, and presence. But when you give it nothing, it slowly begins to give nothing back. And the cost? Far higher than most men realize. Low testosterone isn't just about fatigue or libido. It's tied to heart disease, diabetes, cognitive decline, depression, and even a shorter lifespan. It's not just a number. Your testosterone is a vital marker of how connected you are to life itself. And the most painful part? Most men don't realize how far they've drifted from themselves until it feels almost too late to return. But there is a way back. It doesn't begin with pills or surgery. It starts with reclaiming your connection to your body, on your terms, in your own space, without shame. This is how you remind your biology, I'm still here. I still matter. And if that surprises you, wait until you hear what's next, because there's something even more essential than testosterone, and most men are quietly damaging it every time they touch themselves the wrong way. Secret 5. Erectile function is a use it or lose it system. There's a quiet lie many men start to believe after 60. If I'm not having sex, I don't need to worry about erections anymore. I've heard it over and over, but here's what most doctors don't say clearly enough. Erections aren't just about sex. They're about blood flow, nerve health, cardiovascular strength, and longevity. Take Harold, 69, sharp mind, healthy body, but he hadn't had an erection in over 5 years. Not because he couldn't, but because he thought there was no reason to. His wife had passed, he wasn't dating, so he assumed that part of life was done. What he didn't realize was, his body wasn't waiting, it was shutting down. The penis is like any other muscle or vascular structure. If you don't use it, it begins to break down. Tissues lose elasticity, blood vessels stiffen, oxygen flow drops, microtears form, and fibrosis, the hardening of soft tissue, sets in. Eventually, even if the desire returns, the function doesn't, not because of age, but because of disuse. And that's where the real cost appears. When erections stop, smooth muscle atrophies, blood vessel efficiency declines, nitric oxide, the key chemical for erections, diminishes. And here's the truth no one tells you. This happens even if you're not trying to be sexually active. It's biological. If your body no longer experiences arousal or engorgement, it assumes the system is obsolete. Worse still, the damage isn't just physical, it's psychological. As the body stops responding, the mind follows. Confidence fades. Self-worth slips. You feel less like yourself. Depression creeps in. Cognitive sharpness dulls. Not overnight, but slowly, quietly, completely preventable. So what can you do? Remind your body this part still matters. Whether through self-touch or even non-sexual arousal, regular erections keep blood flowing, tissues oxygenated, neural pathways alive. This isn't about chasing pleasure, it's about preserving your physical health and identity. Erectile function is a message, a signal to your body. I'm still engaged, still connected, still alive. I get it. Society tells you to go quiet as you age, but silence has a cost. And your body, it always keeps the score. Now, if erections are this important, what could you be doing that silently undermines them every day? Get ready, because next we'll talk about the modern addiction most older men never recognize until it's already rewired their brain. Secret 6. Porn changes your brain, but you can take control. Let's talk about something rarely discussed, especially among older men: pornography. Just hearing the word might make you shift in your seat, but stay with me. This conversation could change how you see your mind, your body, and your masculinity. I've worked with men in their 60s and 70s who still watch porn, not out of addiction, but because it's one of the few ways they still feel something. They're not chasing thrills, they're chasing connection, or the memory of it. What they don't realize is this: today's porn is nothing like what they grew up with. What used to be soft, suggestive images is now a constant flood of high-speed, high-stimulation content, and your brain isn't built for that. Every time you watch porn, your brain releases dopamine, the chemical of pleasure and reward. But repeated exposure desensitizes your brain. Over time, it becomes harder to feel aroused by real, simple touch. You begin to crave more intensity, more novelty, just to feel anything. That's not about preference, it's about neurochemistry. Your brain gets rewired. And when your brain changes, your body follows. Erections become less reliable. Orgasm becomes harder to reach. Some men can only function with porn, not with a real partner or even alone without it. This can lead to shame, anxiety, isolation, and most men never connect the dots. The very thing they turn to for comfort slowly steals their vitality. But here's the good news. You are not broken. You are retrainable. Even after 60, your brain can heal. And that's where the real cost appears. When erections stop, smooth muscle atrophies, blood vessel efficiency declines, nitric oxide, the key chemical for erections, diminishes. And here's the truth no one tells you. This happens even if you're not trying to be sexually active. It's biological. If your body no longer experiences arousal or engorgement, it assumes the system is obsolete. Worse still, the damage isn't just physical, it's psychological. As the body stops responding, the mind follows. Confidence fades. Self-worth slips. You feel less like yourself. Depression creeps in. Cognitive sharpness dulls. Not overnight, but slowly, quietly, completely preventable. So what can you do? Remind your body this part still matters. Whether through self-touch or even non-sexual arousal, regular erections keep blood flowing, tissues oxygenated, neural pathways alive. This isn't about chasing pleasure, it's about preserving your physical health and identity. Erectile function is a message, a signal to your body. I'm still engaged, still connected, still alive. I get it, society tells you to go quiet as you age, but silence has a cost, and your body, it always keeps the score. Now, if erections are this important, what could you be doing that silently undermines them every day? Get ready, because next we'll talk about the modern addiction most older men never recognize until it's already rewired their brain. Secret 6. Porn changes your brain, but you can take control. Let's talk about something rarely discussed, especially among older men, pornography. Just hearing the word might make you shift in your seat, but stay with me. This conversation could change how you see your mind, your body, and your masculinity. I've worked with men in their 60s and 70s who still watch porn, not out of addiction, but because it's one of the few ways they still feel something. They're not chasing thrills, they're chasing connection, or the memory of it. What they don't realize is this: today's porn is nothing like what they grew up with. What used to be soft, suggestive images is now a constant flood of high-speed, high-stimulation content, and your brain isn't built for that. Every time you watch porn, your brain releases dopamine, the chemical of pleasure and reward. But repeated exposure desensitizes your brain. Over time, it becomes harder to feel aroused by real, simple touch. You begin to crave more intensity, more novelty, just to feel anything. That's not about preference, it's about neurochemistry. Your brain gets rewired. And when your brain changes, your body follows. Erections become less reliable. Orgasm becomes harder to reach. Some men can only function with porn, not with a real partner or even alone without it. This can lead to shame, anxiety, isolation, and most men never connect the dots. The very thing they turn to for comfort slowly steals their vitality. But here's the good news. You are not broken. You are retrainable. Even after 60, your brain can heal. Conclusion. What comes next may be the most important part of all. Now that you've heard the 7 truths no one ever told you, I'm going to guide you step by step through a simple yet powerful practice I share with my own patients, a daily ritual that rewires your body, rebuilds sensitivity, and restores what time and silence try to take away. If you've made it this far, let me speak to you not just as a doctor, but as a man who has spent decades sitting across from other men, hearing their fears, regrets, and sometimes their quiet hopes. What we've discussed isn't just about masturbation. It's about something much deeper, how you relate to your body, how you carry your history, and whether you're willing to believe that your life, your sexual life, your emotional and physical life, isn't over just because the world told you it should be. We began with the truth that mindless masturbation can rewire your brain and erode your sensitivity. That rushing through the motions, disconnected and distracted, isn't harmless. We talked about how avoiding ejaculation altogether can cause prostate congestion, inflammation, and even increase cancer risk. Your body is designed to stay in motion, and when it stops, systems suffer. We explored the silent poison of shame, how many men carry guilt inherited from culture, religion, or family, guilt that has no place in a healthy relationship with your own body. We saw that low testosterone isn't just a fact of aging, it accelerates when you disengage from your sexual self, and how simple solo touch can start to reverse that. We learned that erections are not just sexual. They're a sign of vascular health and a use it or lose it system. Ignoring this costs more than just your bedroom life. It affects your confidence, motivation, and even memory. We opened the door on pornography, not to shame, but to explain how it rewires your brain chemistry. It's biology, not morality. What once sparked excitement can numb you to real life. And finally, we confronted the most dangerous mistake of all, isolation. When you stop touching, stop being touched, stop connecting in any way, your body retreats, not just from pleasure, but from purpose, emotion, and life itself. What I want you to take away is this. You are not broken. You are not past the point of no return. You are not alone. Every system in your body wants to respond to connection. Your brain still wants to feel. Your heart still wants to open. Your skin still wants to remember what it means to be alive. And that journey back doesn't require anyone else. It starts with you. It starts with the choice to stop shrinking, to stop apologizing for wanting to feel good in your own body, to stop believing the lie that age makes you invisible. You are not invisible. You're still here. What you do with that matters. So here's what I tell my patients when they're ready to begin again. Not with pills, not with guilt, but with presence. I give them a simple daily practice I call the Golden Protocol. 10 minutes a day of quiet, intentional, respectful time to reconnect with themselves. No agenda, no pressure, just touch, breath, and awareness. For some, it becomes a morning ritual. For others, a bedtime routine. But almost always, it becomes a turning point. Because when a man touches himself with care, not out of habit or desperation, but with curiosity, something shifts. His body remembers. His mind softens. His spark returns. And maybe yours can too. This isn't just about reclaiming your sexuality. It's about reclaiming yourself. And that starts right here, right now, with you.